Hi, welcome everyone to the panel on nitrate in drinking water, a public health perspective. My name is Ursula Kreitmair. I'm an assistant professor in environmental policy here at the University of Nebraska, Lincoln. I'm going to be moderating today's panel. I'm joined here by an esteemed group of public health experts. Please welcome Dr. Dan Snow, the Director of Water Sciences Laboratory here at the University of Nebraska. We've also got Dr. Eleanor Rogan, Professor and Chair at the Department of Environmental Agriculture and Occupational Health at the UNMC Epley Institute for Research in Cancer and Allied Diseases. Dr. Mary Ward, Senior Investigator of Occupational at the Occupational and Environmental Epidemiology Branch of the NIH, and Sue Dempsey, Drinking Water and Groundwater Administrator at the Nebraska Department of Environment and Energy. Just to give you an overview of the panel, we're first going to have presentations by our panel of experts. Dan is going to give an overview of nitrate levels here in Nebraska. Mary and Eleanor are going to give presentations on the impacts of these contaminants on public health, and Sue Dempsey is going to provide an overview of the measures that have been taken here in Nebraska addressing these issues. After that, we're going to have a brief discussion on some of the most pressing topics. So to get us started, Dan, would you like to share your screen?
Thank you very much, Ursula, for that introduction. As Ursula said, I'm Director of the Water Sciences Laboratory here at the University of Nebraska, part of the Nebraska Water Center and Water for Food Global Institute. My background, I grew up on a farm in southwest Iowa. I went off to study geology as an undergraduate student and later geochemistry and finally analytical chemistry. So I've had a kind of a background that really resonates with this particular issue, nitrate in drinking water, public health perspective. So how did we get here? That's kind of the way I frame my part of this discussion. This is where we are now, basically protected nitrate in groundwater throughout the United States. Even deeper groundwater used for drinking water system is vulnerable to contamination from nitrate. So why is that? Later in this panel discussion, you'll hear some information about the maximum contaminant level, what that means in terms of human health effects. But I'm really going to just talk about how we got to this position now. As it shows in these two maps that over 30% of drinking water, including private wells throughout the US, probably more like 40 to 50% are contaminated with some level of nitrate. Well, really, this is probably the biggest driver in this process. Haber-Bosch, if you haven't heard, was invented. It allowed us to manufacture a commercial fertilizer in the early 1900s. And this graph from this publication shows that our use of nitrogen fertilizer has just increased exponentially since the 1940s, around World War II. Average application rates in terms of mass per unit area or pounds per acre has increased by somewhere between 8 and 10 times. So we're using a lot more fertilizer. And in particular, we're using fertilizer on nitrogen intensive crops like corn and rice. That's what the two graphs from this particular publication show, is that we're just using more fertilizer and we're using it for nitrogen intensive crops. Oops. Yeah. So back to that map on predicted nitrate in shallow groundwater. This is from that same publication where we saw the change in fertilizer use across the United States. And if you look at the distribution of fertilizer use and compare that to where nitrate occurs in the aquifer, both in the red and the yellow areas, we see that there's a nice spatial correlation, say, between the occurrence of nitrate and our historical use of fertilizer. So I think that's one of the biggest drivers of where we are today. We just have been using lots of nitrogen fertilizer at the surface. That's not the whole story, however. So what's the rest of the story in terms of nitrate contamination? Well, this is a map of nitrate, groundwater nitrate concentrations in the state of Nebraska. We see that there's some areas in particular that they're much more vulnerable to contamination. This area through the center of the state is actually the Platte River alluvial valley. It's where the Platte River runs across the state from Colorado to the Missouri River. And then in the northeastern part of the state, that's the Elkhorn River drainage basin. We have pockets where we get concentrations of nitrate that are more than twice as high as that safe EPA maximum contaminant level. Well, we've studied this process probably for the last 30 years, and what we've come up with are high groundwater nitrate risk factors. The number one risk factor is in terms of the agricultural use of nitrogen is very sandy soils. So if we have sandy soils and we're using fertilizer on those sandy soils, no matter how good we are at applying and regulating the use of nitrogen fertilizer for those crops, we're probably going to lose a small amount below the crop root zone. Another factor that leads to high groundwater nitrate is a high irrigation well density. And we know from previous projects that in particular, gravity or furrow irrigation, such as shown in the photograph, actually increases the amount of nitrogen that's leached below the root zone. And I guess that makes a lot of sense because we're using more water through these less efficient irrigation practices. We're probably going to lose more water, and with that water that is lost below the crop root zone, we can lose nitrate. Another factor are these shallow water tables or thin vadose that I mentioned across the Platte River alluvial valley. Those are pretty shallow water tables for the most part, very thin vadose, not much time that it takes to go from the crop root zone down to the water table. So these factors all contribute to the areas that you see in the map of high groundwater nitrate, at least throughout Nebraska. Well, that isn't the whole story. I think I had to cover this topic in about 5 minutes or less. So this last slide really just talks about the complexity of the nitrogen cycle. Any form of nitrogen that's added to the surface beyond plant needs, whether it's a corn, soybean, or pasture or alfalfa, will result in nitrogen loss. And that nitrogen can come in the form of commercial fertilizer that we might see on the right-hand side of this slide, or in animal manure, livestock manure, if we over-apply organic nitrogen from these sources, and then we add commercial fertilizer on top of that, is going to lead to leaching. And then the soil zone or the vadose zone that's shown by the brown box in this illustration really shows that there's a lot of complex transformation processes that result in the formation of nitrate. Any process that affects how that nitrogen is transformed into nitrate will affect the amount of nitrate that's leached below the root zone. So in summary, nitrate in drinking water is a big problem. It's one that's crept up over the past, say, 50 to 60 or even 100 years now. Fertilizer use has grown by almost 10 times since the 1940s, when we were able to start manufacturing nitrogen fertilizer from the atmosphere. And with the heaviest uses associated with these nitrogen intensive crops like corn and rice. Groundwater nitrate concentrations and occurrence tends to be related, at least spatially, to this heavy nitrogen use. Most vulnerable areas have sandy soils, a high irrigation well density, a shallow water table, a thin vadose zone, and rapid recharge. That is, it doesn't take very long for the water and the nitrate nitrogen to move to the water table. And finally, that nitrogen cycle is very complex, but excess nitrogen of any form will result in nitrate nitrogen leaching loss below the root zone. And that's the end of my show.
Thanks, Dan, for the presentation. Let's move on to some of the actual health impacts of this contamination. So Mary, would you like to share your screen?
Right, thank you for the opportunity to speak to you today. And I'm just going to give a brief overview of health effects of nitrate in drinking water. I am an environmental epidemiologist at the Division of Cancer Epidemiology and Genetics at the National Cancer Institute in the Maryland area outside of DC. And I have a background in ecology as well as epidemiology. So just briefly, the overview, I'm going to talk about the biologic effects of ingestion of nitrate as they relate to formation of nitroso compounds, and these are thought to be the bad actors, not nitrate itself, in relation to adverse reproductive outcomes and cancer. So that, as Dan alluded to, the MCL for nitrate in drinking water, which is only for public water supplies that are regulated by EPA, was based on methemoglobinemia, which is an acute health effect, or sometimes called blue baby syndrome. So other health effects that have been studied include adverse reproductive outcomes, cancers, and thyroid disease, and I'll briefly be going over those effects. So, but first, a little bit about how nitrate ingestion forms nitroso compounds in the body. When we ingest nitrate through drinking water or diet, it is actively transported into our saliva, and nitrate in the mouth is reduced to nitrite by the oral bacteria or the oral microbiome. So this nitrite, which is a very reactive molecule, is swallowed, and in the acidic stomach forms nitrosating agents that can react with amines and amides that are common through our diet to form these N-nitroso compounds. This is a class of compounds, and this reaction is increased in the presence of heme iron that's found in red meat, and decreased or almost eliminated in the presence of antioxidants like vitamin C. So there's been over 300 nitroso compounds that have been tested in animals, and 90% were found to be carcinogenic. These are carcinogens in every animal species that's been tested, including non-human primates, so it's unlikely that humans are not affected. These nitroso compounds can cause tumors in multiple organs, including the lung, digestive tract, urinary tract, and some reproductive cancers. In utero exposures, also known to cause congenital malformations, especially of the central nervous system, and the first trimester is particularly important when those organs are developing. So just quickly, there's been a few studies also looking at spontaneous abortions, and we know that high maternal methemoglobin levels caused by ingesting high nitrate can cause abortions in lab animals as well as in livestock. And in 1996, there was a very intriguing CDC report of a cluster of spontaneous abortion among women who are on private wells in rural Indiana. And their wells were determined to be all above twice the MCL of 20 milligrams per liter as nitrate nitrogen. Once the women switched to low nitrate water, they had healthy live births. So this wasn't a formal study, but was fairly compelling evidence that this high nitrate water was involved in their miscarriages. Later, a study, or actually this was earlier, a study in Massachusetts found no association between spontaneous abortion and lower levels of nitrate that were all below the MCL, or about half the MCL. But by far the most well-studied adverse reproductive outcomes are central nervous system malformations. These are ascertained in the US through the National Birth Defects Registry, and 5 of the 6 studies have found increased prevalence of these, one or more of these malformations among women who had higher versus lower nitrate concentrations in their water, and most of these studies were looking at women on private wells. So these were studies in Australia, 2 studies in Canada, and the rest were in the United States. And I wanted to point out that in 4 of these positive studies, nitrate concentrations were below 10 milligrams per liter, or the MCL. So turning to cancer, in 2006, the International Agency for Research on Cancer convened a working group to evaluate the evidence for carcinogenicity of ingested nitrate and nitrite, and they concluded that nitrate and nitrite were probably carcinogenic to humans when they were ingested under conditions favorable for endogenous nitrosation, which is just another way of saying the formation of these N-nitroso compounds that I talked about. And these evaluation was based on very strong evidence from animal studies that I showed you briefly, and also on human mechanistic studies or feeding studies where people are given a controlled amount of nitrate in drinking water, and it was demonstrated that nitrate ingestion increased nitroso compound exposure and measured as excretion of these compounds in urine. In terms of the epidemiology studies, there were quite a few studies that looked at dietary nitrate, and none of those were associated with an increased risk of any cancer. For drinking water nitrate, it was considered that the evidence was inadequate because there were a few studies of specific cancer types. Exposures were mostly low, focusing on the population using public water supplies, so exposures below the MCL, and factors affecting endogenous nitration, like dietary antioxidant intakes, were not usually considered. So I just wanted to briefly give you an overview of the strongest study designs looking at drinking water nitrate and cancer. And these are case control or cohort studies where the exposure is assessed for individuals. So this just gives the cancers where there's been 2 or more studies of this design, and shows a number of total studies and the number that were positive in at least one subgroup, like men or women, or subgroups that you would expect to have higher formation of nitroso compounds. So the strongest evidence to date, and you can see in the epidemiology field, these are not a lot of studies, but the strongest evidence to date is for colorectal cancer, where 4 out of 5 studies show positive associations. And for childhood brain tumors, which one study also included young adults, where 3 of the 3 studies have shown positive associations. And 2 of these studies were just done in the last year, or published in the last year. So for the other sites, there's really less evidence. And then finally, I wanted to end talking about some studies of nitrate in drinking water and hypothyroidism. And the biologic plausibility here is not through nitroso compounds necessarily, but that nitrate can inhibit iodine uptake by the thyroid. And that's a typo, I should say uptake. 3 studies showed positive associations with higher water nitrate ingestion. So just briefly, one was a study in children in Slovakia that found children who had higher water nitrate had increased prevalence of subclinical hypothyroidism determined by ultrasound. A cohort study of postmenopausal women in Iowa found higher nitrate intake when assessed for both diet and drinking water sources, and these were women using public water supplies. So women with higher intake had a higher prevalence of hypothyroidism. And then in an Amish cohort in Pennsylvania, women but not men had a higher prevalence of, or higher levels of thyroid stimulating hormones, which can lead to hypothyroidism. And we classified those hormone levels into levels of subclinical hypothyroidism. So that was also associated with nitrate intake about half the MCL or above. And that association was in women, but not in men. So some evidence that higher nitrate in drinking water may affect the thyroid and thyroid disease. So just wanted to end with a couple points about research needs. I think there's more that can be done assessing the oral microbiome. There's certainly variability in how people reduce nitrate to nitrite. And we have tools to look at that. Studies that incorporate biomarkers are probably going to reduce our misclassification of exposure. And we certainly need to consider other water contaminants as well as nitrate when we're looking at these health effects. And incorporate populations with high exposures, which tends to be the people using private wells that are not regulated. And I just wanted to also just point to a couple of review articles that I'm referring to in my talk. A report done in 2005, and then we did an update in 2018, and then 4 recent papers that were published on drinking water nitrate and cancer. And just thank my collaborators, just some of the people I've worked with over the years. Thank you.
Thanks, Mary, for the presentation. That was really interesting. Eleanor, do you want to go ahead next?
I'm Eleanor Rogan, and I'm happy to talk to you today about the possible role of agrochemicals in pediatric cancer. As you can see, I chair the Department of Environmental, Agricultural, and Occupational Health in the College of Public Health at the University of Nebraska Medical Center. We've had a group that has been looking at this question for about the past 5 years. our hypothesis is that water quality in Nebraska may play a significant role in the high incidence of pediatric cancers in Nebraska. I think Nebraska currently ranks about 7th in the nation in terms of the incidence of pediatric cancers throughout the state. And so we've been looking at this in a somewhat unusual way, in that we've divided the state up into what are known as into watersheds. And a watershed is simply an area where all the water drains to a central point, or a lake or a river or a stream. And you can have watersheds on all kinds of levels. We picked for utility in these studies a level where there's about 70 or so watersheds in Nebraska. That seemed to be a good working level for us. And we have looked at the health data, because Nebraska has had a really good cancer registry run by the Department of Health and Human Services since the late 1980s, and also has other registries, but that's one we've looked at the most. We have looked at water quality data that we've obtained from EPA's STORET database, from the U.S. Geological Survey database, and also from what's known as the Nebraska Clearinghouse, which has other water quality data that collected over the years. And lastly, we've begun to look at water quality ourselves and to conduct some studies now. We think this is a relevant thing to do because, on the whole, the population and the use of land in rural Nebraska doesn't change much. And so we think there's some validity to this approach. So what we've been doing is, well, first of all, we have the cancer registry. So we have retrieved the data for children aged 0 to 19 years. In our initial study went to 2014 from 1987. We've now updated that to 2016. We then mapped that using GIS software, and we then determined the incidence in these watersheds by getting pediatric population counts from the census in 2010. We decided that was, again, to use that year was the best that a good compromise that we could validate. Then as I said, we looked at these databases for nitrates and atrazine, and we also have collected some water quality data in a variety of ways, including by citizen scientists who we found could be trained to collect water data that was legitimate. Okay, so here's a couple of here's a map of the pediatric cancer incidence in these 20 years, and as you can see, it varies throughout the state. These I'll call them pale yellow areas, are areas where there's so little population and so few cases that we couldn't use those data. However, we have a high incidence of pediatric cancers in this watershed, which is the upper Elkhorn, and then you can see in other watersheds throughout the state. And then we have some areas that have medium levels of pediatric cancer incidence. We broke that down further because a quarter of all the pediatric cancers in Nebraska are actually central nervous system tumors that include brain cancer. This is by far this is the most prevalent. Then we have leukemias and lymphomas, and then all the other types are just a third of the pediatric cancers, so we lump them together. We then map those out throughout the state, and what we found, well, if we look at the state as a whole, is that the brain and other CNS tumors, that incidence is significantly higher than the national average. That's what really seems to be driving the high incidence of pediatric cancers in Nebraska. Leukemia and lymphoma are both about average for the entire country, but brain tumors and other CNS are really, really high. And we map those out. And you can see the pink areas here are the watersheds with higher than national average incidence of brain and other CNS tumors. And then similarly for leukemia and lymphoma. And but I think the most striking is that is this map of the brain and other CNS pediatric cancers. We also include here a map of the crops that are basically grown in Nebraska in these areas. And what is striking, but it's not a statistically associated set of information, is that this map looks a lot like this map, where the high incidence of CNS tumors seems to go along with where corn and soybeans, there really are black dots in among these green dots. And corn and soybeans are grown. And the significance of that is what kinds of fertilizer and agrochemicals are used, including nitrate in this area. And then over here you have where a lot of wheat is grown. But we tried to see if there was a statistical correlation between the high incidence of CNS tumors and the amount of land in each of these watersheds, the proportion that you actually used for agriculture. We didn't find a significant correlation, but it still is an interesting map. It also is a map, I can't show you this, but it's a map that aligns with areas where a lot of the irrigation of the cropland is done with groundwater. So that's another factor that we're looking into. We decided that here we've plotted out the watersheds in Nebraska with high incidence of CNS tumors and also high levels of nitrate. And then we've picked we've picked three areas that we're going to study that we are studying in more detail. This is the lower Elkhorn watershed and the upper Big Blue are two that we're working in today, because we want to look more closely to see if we find associations between where pediatric cancer patients lived and where the water might be high in nitrate in particular. We are sampling, in order to do this work, we're sampling both groundwater and surface water. We're sampling domestic wells for nitrate and some other agrochemicals, as well as these geogenic uranium. There's uranium and also some arsenic in the ground in parts of Nebraska. And the presence of higher levels of nitrate in the water tends to release the uranium from the soil. So that's our current, these are our current studies. And I just want to thank the various students and other staff and other faculty. This is a joint project between the University of Nebraska Medical Center and the University of Nebraska at Lincoln. So we have, so that's what we've been doing. And we hope that it will enable us to shed some light on the possible role of nitrate as well as other agrochemicals in this high incidence of pediatric cancer in Nebraska. So that's that's what I have to tell you about our research group. And I'll turn the microphone back over to our moderator.
Thanks, Ellie, for the presentation. That was really upsetting, but very interesting. So let's have our final presentation. Sue, if you'd like to take over, and then we'll have our discussion.
Great, thank you. So my name is Sue Dempsey. I administer the state drinking water and groundwater division. Prior to that, I was the state toxicologist. So I've been in the field studying nitrates and other contaminants in drinking water for a while now. In our program, we deal with surface water, and as you know, because we're the groundwater state, we do a lot to monitor and keep track of things going on in the groundwater in our state. So my presentation, I'm going to show you some information on private well samples that have been collected over about the last decade. A map showing nitrates in groundwater by township in the state. Showing you a map with some public water systems that have been impacted by nitrates. What we do to regulate that in public water, as it has been mentioned by some of my previous presenters, we do not regulate private wells. They're private for a reason, but we do regulate community water systems. And then I'll talk a little bit about drinking water and wellhead protection areas and our wellhead protection network. So this is a map of nitrates by township. There is one typo in the footnote of that map. It says that it was made in 2012, which wouldn't correlate with the data on the map. That's supposed to say 2019. So just one typo I noticed this morning. But as we mentioned, or as has been mentioned, you know, our state is very susceptible to nitrate contamination, primarily due to sandy soils in some regions and shallow depths to groundwater, concentration of irrigation, those sorts of things. Sources of nitrates, most folks that are probably participating in this webinar are familiar with what those are related to ag, but there's also septic systems that maybe aren't performing well that contribute to that contamination, and then also sometimes some fertilizer spills. There are 23 natural resource districts across the state, and they take samples proactively in their different regions and send that in for nitrates, and that is private wells. It does include, those samples are free, by the way, but it's not just domestic wells. So there's monitoring wells around livestock and other ag facilities, irrigation wells, domestic wells, some public data, commercial, like if it's a factory, for example, or like stock wells for livestock. We do encourage nitrate sampling from private wells. I encourage that everyone do that at least annually. I don't think that often occurs, however. Excuse me. The data Ellie mentioned, we have a database, excuse me, called the Nebraska Clearinghouse. That is data from multiple agencies, and it's all in one location. It's very user-friendly and easy to search that and find data in a particular area of the state, or if you want to search and look at data for a particular contaminant. This is a map similar to the one Dr. Snow showed. It's a little more up-to-date, showing nitrate contaminations across the state. Again, this is from the data that I just mentioned that comes from everything from irrigation wells to private wells to stock wells, those sorts of things. This map is honing in on that just a little closer. So if we looked at registered domestic wells in the state, we have about a little over 32,000 of those. This represents those that have been sampled, which is a small amount, which is about 19%. These occur when there's property transfer that is required, but there's no requirement if a new well is drilled, for example. So I'm working to, with the university and some other folks to see what we could do to maybe get those folks to share that data with us, perhaps if we offset the cost of this sample for them. The samples are only about $16, so they're not really expensive, but somebody might be more apt to share that data if they're not paying the full amount for that. Again, because my role at the state I have primacy, which means I do the enforcement for EPA in our state, as do most states. We only regulate community water systems, not private wells. And as you can see by looking at this map, it's very similar to the map that I showed previously as far as where those high concentrations occur. This is a map that shows public water supply information. I updated this just recently as far as the ones that have administrative orders. So the ones with the triangles, the red triangles, are where a community has treatment in place for nitrates. So they've already had some violations for having nitrate levels above the MCL of 10. And because of that, then they had to put treatment in place. One thing we do in our state is we proactively start issuing violations and working with a community when their levels are over 8. So if they ever exceed the level of 8, we switch them from annual monitoring to quarterly monitoring and keep track of those levels. And if they continue to go high, then we work with those systems to correct that. The systems with administrative orders are those that are actively pursuing either getting treatment or modifying their well or making some other adjustments to ensure that their communities are protected. I did want to mention one thing with this data. Public water does not necessarily mean a community system, like a Grand Island or a Schuyler or a bigger system. It could be a system such as a gas station. That's also a community water system. They have a transient population. It's not the same population drinking water from them all the time, but we do regulate those as well. So factories that might have their own well, a rural school that might have their own well, those are all community systems. So some of these violations might be related to, they might have an RO unit, a reverse osmosis unit at a gas station, and it hasn't been well maintained. So then they get a nitrate reading that's over 10. So then we work with them to, hey, you need to get out there and take care of that. So this is the most recent results we have for nitrate violations. As you can see, those are trending downwards. We have had some upward spikes in 2020, but not significant. Again, those are primarily related to non-community, or transient water systems like gas stations and some of those smaller systems. Monitoring violations can be something simple like there was an error in the sample collection and they need to just go out and recollect that sample, but we do cite them for that regardless. And then as you can see, the percent of systems with violations is really low. So at least on the public water side, the exposure to nitrates above the MCL is very low in our state, and I'm very proud of that. I do supervise a gal whose full-time job is wellhead and source water protection. So she works with communities to prioritize areas around public water wells to make sure that they're protected from impacts from contamination, not just nitrates, but other contamination. So they do a survey of businesses in the area that could be sources of contamination. They do a survey of private wells in the area, and then they designate these areas as wellhead protection areas or drinking water areas. With that designation, they are eligible for more federal or state funding for different things. It helps them with local planning for developing city ordinances, perhaps that say, hey, we're not going to allow any private wells or irrigation wells in this particular area. Because the majority of citizens in our state receive water that comes from groundwater, it's really, really important thing to do. Omaha is probably our largest community that drinks surface water, but most of the state is served by straight up groundwater. This is a picture of our current wellhead protection areas. Those are the red squares listed here on the map. As you can see, we've got a ways to go. I'd like the entire state to be a wellhead protection area, but it doesn't always work that way. But there is a heavier concentration in those areas where we also do have high levels of nitrate. So that is good to see. The collaboration that I mentioned, we partner with the agencies listed there in the gray box on the right to come up with ideas, with peer learning and collaboration on what we can do to protect our groundwater and exposure. With the new Farm Bill, there's some monies and resources that are coming there to help with conservation and help prioritize those areas. And then the surface water program, the wellhead protection program, non-point source pollution folks at our agency meet on a regular basis to make sure we're all aware of what's going on, if there's any issues in an area, or what we can do to prioritize funding in our state for helping these communities. And that's all I have. Thank you.
All right, thanks a lot. So these presentations were really informative, and for someone who's not from the from that particular area, I found this really helpful in just getting a better sense of the situation in Nebraska and the extent to which it impacts public health. So I was hoping that we have time for about 20 minutes of a discussion. So I have a few questions. I provided some of those beforehand, but just listening to the presentations, I had additional ones. So pardon me if I just throw some new ones in there. But I would like to have this be an open discussion. So if there are any questions amongst the group, please just jump right in. So just to get us started, from the presentations, it looks like fertilizer use has been on the rise, which has led to this nitrate contamination levels. Is that something that we predict to continue to be the case? Are we expecting fertilizer use and nitrate contamination to keep on growing?
I guess I'll answer that. Fertilizer use is sort of plateaued, so I don't see that we're going to increase use beyond the current rates. It is going to take quite a bit of effort, though, to get application rates to go down. And the main reason for that is farmers are really geared towards maximizing yield to maintain production and basically keep their operations profitable. So without any kind of intervention, I think we're going to stay at the same rates that we are now.
That actually brings up a really interesting follow-up question in terms of, are there any types of interventions being planned for this kind of preventive measures in terms of reducing the contamination before it even happens? Or is most of the emphasis essentially on cleaning up any kind of contamination issues?
Dan can probably answer this better than I, but there are best management practices that producers can incorporate, and those things improve every year. There's a lot of folks working to help with that, for things like no-till application rates, for the crop, and monitoring those sorts of things. So yeah, I agree with Dr. Snow. I don't see those things going up. It's just a matter of awareness and outreach to ensure that those practices are incorporated.
That did anyone want to add anything to that? Or
this is Mary. I had a question because in some of the in Iowa, adjacent state where we've done a lot of our studies, animal feeding operations, concentrated animal feeding operations, have contributed to the nitrate problem in drinking water. And I just wondered if you could comment, and I think there was some mention of manure applications, but how that's changed over time and maybe contributing, and what you see for the future.
So there are some instances where we definitely have over application of manure, and often it seems that we're not doing a good job of accounting for the nitrogen that's applied from organic sources, and then putting inorganic sources of nitrogen on the same field. So that's something I think we could do a better job of, is just making sure that we account for all the nitrogen that's available to the crop each year. And that's just going to require further education, maybe some more intensive soil sampling. And I know Nebraska has nutrient management plans that definitely has a framework for this to happen. I think we can be short-staffed in that we don't do a lot of follow-up with that to make sure that it's happening the way that it's intended to.
Mary, we do also monitor. We have monitoring wells around livestock facilities in the state. We've had that data for many, many years. That's also shown on the map that that Dan and I provided. So, if we have one that is having some issues significantly, they work with that producer to see if there's some modifications or something that has gone in, at that facility to correct that.
Thank you.
I think that brings up a follow-up question in terms of what public awareness is actually like regarding this issue in terms of over fertilizer use, contamination levels, and also the related health impacts. If the group wants to comment on that.
I'm going to comment. I actually, we hosted a retreat yesterday with several agencies, including UNMC, UNL, natural resource districts. We're going to start doing community water events and doing outreach to talk to folks, not just about nitrates, but about protecting water quality in general. I felt very enthused about that. Rather than us all being siloed working on our individual projects, we're going to powwow and come together and figure out the best way to get this information out to the community. We'd like to focus on younger generation too, high school kids, middle school kids, help raise awareness in that area and that population as well.
So if I could give a plug to our Know You Well project through the University of Nebraska, that involves youth high school science and vocational agriculture students that go out and collect samples from private wells. They end up doing some of the testing, and they send other samples to laboratory for testing. I think that's also another kind of youth-led groundwater awareness program that could really help move the dial in terms of community awareness about this problem and what we might be able to do about it.
Yeah, and I'm hoping that we'll be able to provide some of this information and make those resources available to any interested viewers of this so that they know immediately where they can actually get more information on these programs. But Mary and Ellie, what are your thoughts in terms of public awareness regarding the actual health implications of these contaminants?
Well, I think there's not a lot of public awareness. I know that we had a meeting that was this summer that included university faculty and also people from the Department of Energy and Environment, and then also from our natural resource districts, which is a unique kind of organization that's in Nebraska, that's they cover the state. And the NRD guys were very enthusiastic about and asking us to please increase and put out more health related data, because they thought that kind of data would probably help in making the case about for farmers to try to think about, and do some work to not be spilling nitrates into the waterways, et cetera. They felt like that was a new kind of data that had not been promulgated throughout the state, and that was could be really helpful in trying to reduce the amount of nitrate that's going into the water.
Yeah, and I would just like to add to that. First of all, I thought Ellie's talk was really interesting, especially given that there's these two recent studies that have looked at childhood brain tumors and drinking water nitrate. I guess I wasn't aware that the rates were elevated in Nebraska. So very intriguing results. Childhood brain tumors, fortunately, are very rare. So maybe there's not as much awareness of the potential link. And again, some of these studies are fairly recent. So it's difficult to study. It's great that you're doing that work in Nebraska. the one of the studies I referred to is a study in Denmark where they've linked their whole population to their water quality data. It's a population of 5 million people, and found a relationship with the highest levels in public water supplies and childhood brain tumors. So with a fairly, again, still a rare disease, but they had a big population to study. So that's some of the more recent work. And then I find that people, when I give talks, at meetings or at, I've given talks at the Iowa Groundwater Association and other meetings, national meetings focused on the nitrogen problem. The National Academies just had a meeting about that. People seem to be aware of the acute health effect of blue baby syndrome and, the concern for pregnant women, but not so much on the studies of cancer. And that's not surprising because these studies take a long time and, the literature sort of accumulates slowly. So I think maybe getting out these review articles are helpful, just to kind of give a picture of what's been done. And we do have some ongoing work in the agricultural health study cohort that mostly uses private wells that will hopefully be coming out in the next couple of years.
So your talks focused mainly on the carcinogenic effects of nitrates and some of the reproductive issues associated with it. Is there evidence or are there hypotheses that there might be additional health impacts related to this type of contamination?
Well, I mentioned, again, quite briefly, but there's been a few studies looking at thyroid disease, particularly hypothyroidism, because nitrate is known to affect, it basically competitively inhibits iodine uptake by the thyroid. So it's particularly perhaps if you're slightly iodine deficient, that may be particularly important. But again, there haven't been that many studies, and it's difficult to do these studies because you need measurement data for people's water supplies. You need studies that ask about the drinking water source. And so the studies today have mostly focused on people using public water supplies because that's where the data are. But there's more and more happening. So I think we'll learn more in the next few years about these health effects. But in terms of other than what I talked about, there are not a lot of studies that have looked at anything else. And I think these are the main focus. And certainly there's a lot of evidence for nitrosamines and cancer and congenital anomalies. So that's sort of been the biologic underpinnings of this research.
I was just going to say that I really found your, Dr. Ward, your information about the microbiome and how that impacts nitrates, because I think that's really a key component here. A lot of these studies, it's a positive association, not a cause and effect. But I think there is more to it than just the consumption, and doing exposure studies is challenging for drinking water because you never really know how much somebody is drinking. Depending on their nutritional status, their body weight, their age, their general health status, there's all kinds of things that impact what those adverse effects might be for them. And as a risk assessor and toxicologist, I spent a lot of time doing that sort of work. So I found that microbiome, in general, just to be a fascinating component of this. So I appreciate you bringing that forward.
Yeah, there's limited studies, but there are some, and some of them go back quite a few years in understanding how ingested nitrate relates to nitroso compound formation. We know that if you get rid of the oral microbiome or decrease it substantially with antibacterial mouthwash, that you reduce the amount of nitroso compounds that are excreted. But of course, that's sort of as an extreme example. But it's an exciting area, I think, for future studies because it is possible to collect samples from the cheek cells, buccal cell samples that can be analyzed for microbial DNA and then characterize the oral microbiome.
One thing I wanted to add to just the health discussion is that it's a very slow system. This problem has basically cropped up over the space of almost 100 years. and the health effects require much time to become apparent. One of the responses I get when I give a talk is that, well, this contamination happened decades ago. We're doing much better now, and we can't do any better than we are. I think there is a disconnect because there's such a long time frame that we're talking about, first in terms of the physical system and then the human health system. Trying to get people to understand those connections is very difficult.
And I had a question, Dan, for you. Isn't it true that, excuse me, that nitrate tends to accumulate in groundwater? So even though fertilizer applications have leveled off, you would still expect the levels to continue to go up because the nitrogen fertilizer is continually being applied.
Yeah, it takes a long time for a nitrate to dissipate. Under most conditions, groundwater is oxic, which means it has some dissolved oxygen in it. And unless we have suboxic or anaerobic conditions that lead to nitrate reduction, that nitrate is going to be there maybe even for centuries.
I think that's probably the case for most contaminants. Once they're in groundwater, it's really difficult to get them back out of there, especially, if the groundwater is 100 feet or more below the surface.
So what are the options for individuals who might have a private well, seek to get it tested, and then if they have high levels, what do you do?
We do lots of nitrate testing at fairs and festivals, and I'm really surprised at the number of people that choose not to know. I had a woman walk by our booth recently at Husker Harvest Days, and I said, "Hey, we're doing free nitrate testing. Would you like to have your water tested?" And she said, "I probably ought to do that, but I'd rather not know." And she had 3 children with her. So my advice to her, as it is to anyone that has a private well in the state, regardless of nitrates, is a RO system. You can put a reverse osmosis system under your sink, your kitchen sink, so you at least have one place that the water is being filtered for everything from uranium that Ellie mentioned to arsenic, which is naturally occurring in our state. I recently did a study on manganese, which is really high in eastern Nebraska. So RO systems are about $250. You put a unit under your sink, maintain those, then you're preventing that exposure while we figure out how to minimize nitrates in our environment.
Yeah, and unfortunately, from like the social and behavioral perspective, unfortunately, it's somewhat common that individuals don't want to find out about potentially bad information, so they'd rather just stay in the dark if that allows them not to have to deal with these negative emotions. So that is very discouraging in these types of applications. Are there any policies or measures that help individuals with the cost of RO systems or help them get those installed, organized, maintained, or anything like that?
I
have no authority when it comes to private wells other than advice. So
there are county regulations that require well testing, and if the concentration of a well exceeds that 10 milligrams per liter, then the property owner is required to do something about that contamination before they will allow it to be sold. Not every county does that. I think it's mostly Lancaster and maybe Douglas counties that offer that, but I would think that would be a policy that we should maybe consider across the whole state and even the U.S. Because that puts the burden on the property owner then to make sure that when they transfer the property, the well water is safe to consume.
There are some programs that they're not huge, but there are some programs that will offer private well owners financial help with putting in RO systems and things like that.
And those wellhead protection areas I mentioned, one of the benefits of designating a wellhead protection or drinking water protection area is so those local ordinances about doing things like that can be developed.
All right, so there is some movement in terms of providing some assistance to individuals who are seeking to reduce
One thing
the.
I wanted to add
Yeah.
to that, though, is so buying a system is one thing, but making sure that it's properly maintained and that the filters are changed when needed is another expense that probably does not get very much visibility. And really, there's nothing that I know about that would help support that to happen. So just buying a system is only the first step. You have to properly maintain them while they're being used.
And in the eastern part of our state, where we have real high iron and manganese, those plug those filters up pretty quickly. So,
Yeah, that is clearly an added financial burden on individuals who are seeking to actually alleviate that situation for themselves. So that gets me to a question of whether you consider the MCL that is currently set as a safe level, or is there evidence that there are some negative impacts before then? And I know that Nebraska is actually doing some proactive testing and requiring additional tests at 8 parts per million. So I'm just kind of curious to hear a little bit about your thoughts from the whole group.
I can start. I think there are, as I kind of tried to give a really brief overview, I think there is some evidence that, particularly for CNS malformations, again, a very rare outcome, but a very heartbreaking one, that the studies have mostly seen associations with higher nitrate levels in the wells, and at mostly levels below the MCL. The cancer studies, again, it tends to be sometimes subgroups when you can look at those who have lower dietary antioxidant intake. So, and there's a good chunk of people who don't eat a lot of fruits and vegetables. So we can look at maybe a quarter of the population who has lower vitamin C intake and higher nitrate intake in their water. And that seems to be where we're seeing some increased risk for a few cancers. Again, there's not a lot of studies to date, so it's really hard to draw firm conclusions, but I think the evidence is building, and certainly for the childhood brain tumors, that's quite compelling. In there, you're just looking at a period of, I think I forgot to mention this, but it's probably in utero exposure that's most important. So I was glad to see there's quarterly measurements when levels get up near 8 milligrams per liter, because having that quarterly data to really try to assess exposures during the pregnancy is going to be really important for future studies of childhood brain tumors.
and as everybody knows, it takes forever for regulatory development for a new chemical to raise a level, lower a level, or add a chemical to the maximum contaminant level list that EPA has. There's promulgation right now for a new class of chemicals, PFAS chemicals, that are going through the works right now. But as far as Nebraska and most states, we are required to be as stringent as EPA. We can be more stringent then, but that's very rare does that occur, except in select states where they're able to promulgate their own MCLs. So we will follow what the EPA does, and I don't see that changing anytime soon, I guess.
One thing I wanted to add is it's not just nitrate. I think, and I'm glad that the presentations that came after mine pointed that out. The water that's vulnerable to nitrate contamination is also susceptible to some of these other contaminants. Occasionally we see agrochemicals. Very often we see geogenic contaminants like uranium and arsenic. So it's likely that people are getting exposed to a mixture, right? And I think if we show that it's not just nitrate, people are going to pay attention and want to do something more about it. Nitrate, it seems like it's not really that big of a health concern, but when you talk about some of these other chemicals and even natural contaminants, then people do start to pay attention.
Yeah, I agree that arsenic certainly gets people's attention because everybody knows that's, a group 1 carcinogen and it's a poison. But I would comment on the relationship with nitrate that really tends to vary. Up in New England, where we did a study of bladder cancer, we didn't see a strong correlation with nitrate arsenic levels. So it kind of depends where you are, but I think that's a really good point. And certainly aquifers that are vulnerable to nitrate contamination, which is very mobile, are also going to be vulnerable to other man-made chemicals like pesticides. And the neonic insecticides are kind of a new, relatively new insecticide that is being found in groundwater since it's used as a seed treatment. So something else to consider. So I strongly endorse the idea of looking at mixtures, but you have to have the data, the measurement data. So that's where the regulations come in, and certainly additional efforts to do exposure studies are important.
Well, for public water, as you know, we monitor for a couple hundred different contaminants, but for private water, we don't have that data. So it would be nice to have, and it would be nice if folks would test for specific things for their region. You know, if you're along the Platte River, you might have higher levels of uranium. If you're in eastern Nebraska, higher levels of manganese, those sorts of things, and then we would have that information. But it's very difficult to gather.
So we are short on time, so I'd like to wrap up our discussion, but I want to give everyone the opportunity to provide a last comment, or perhaps for individuals who are concerned and maybe one thing they can actually proactively do, or any other type of comment you would like to finish on.
I will start. Since I'm out of caffeine, I need to run do that. So I would say if you have a private well, you should test annually for nitrates and bacteria at a minimum. And depending on where you live, perhaps uranium and manganese or arsenic. And you could reach out to the state to get that information.
I second what Sue just said.
I also do. And I think just having people be more aware and think about, particularly for if you're thinking about being pregnant or you're have small children, that this is a potentially important source. We drink, glasses of water every day, and it's important to think about what's in your drinking water.
So I guess I'll add to that. I'm really happy to see that people are interested in this topic. I'm glad that Water for Food has sponsored a session on this particular topic. Water quality is always on my mind, and I'm always happy to see that other people are interested and that we got a chance to share kind of what we know about this particular topic.
All right, thank you so much. This was a really interesting panel and some really worthwhile information. Thank you so much.